I'm Dr. Nicholas Jones, Nipandtuckplasticsurgery, and today we are talking about gynecomastia. So what is gynecomastia? Basically, it is enlarged breast tissue in males, and it is a result typically of a hormonal imbalance between estrogen and testosterone. Some of the symptoms or problems caused by gynecomastia may have breast pain, swelling, or typically have a male patient say, "Hey doc, I've been working out, exercising, and despite all of my efforts, still have the man boobs." There are several risk factors that may develop or lead to gynecomastia. One, during puberty, typically there's a hormonal imbalance, so it's somewhat normal to have development of breast tissue, but as males, as we get older, typically that goes away. And then there's another point in life, older men like 60s to 70s, testosterone levels begin to drop, and there's another incidence in where the gynecomastia is increased. There are certain medications that may lead to increase of the development of breast tissue. These include like Spironolactone, hormonal medications, as well as the use of marijuana. So how do we treat gynecomastia? It really just depends on the severity, but surgically, depending on the severity, there's several options. One can be liposuction alone. Typically I use liposuction with some sort of energy device. The main reason being is it's not just fat tissue, it's also breast tissue. So when you're performing liposuction, it's pretty easy to remove the fat, but when you have glandular tissue and you do the liposuction, even using the energy, you may not be able to get all the breast tissue out. And so in those cases, typically can make a periareolar incision in the nipple and excise the fat directly. So we just cutting out some of the breast tissue. So the difference, so we did lipo. So after you do the lipo, so the problem is, so there's still some tissue in there, and that's the breast tissue, and we're gonna just try to get that out. In more severe cases where men actually have breast tissue and they have skin laxity, it may require a scar or incision placed on their chest in which we excise a large amount of skin. With that particular procedure, it's not one of my favorites because it leaves a visible scar on the chest. However, when you have a severe amount of laxity, that may be the only option.